Morning. We are here on our Zoom call. I'm Katie with Oregon Cancer Foundation, and I'm here with Anne Gallagher, one of my favorite people in the world. Her and I both worked at Willamette Valley Cancer Institute together, and she's going to share her story a little bit. So, Anne, now what is your new title?
I am the practice administrator at Willamette Valley Cancer Institute, which means I take care of lots of things. But think of me as like the person who takes care of all the rules and regulations and a lot of the business operations of the practice.
And Anne is a cancer survivor as well. Can you tell us a little bit about your cancer journey?
Sure, I am coming up, I think next week, I will be an 18-year lung cancer survivor. So it's been a really, really long journey. I can't believe it's been 18 years. I was first diagnosed at 25 with lung cancer and had the majority of my right lung removed, and really was watched for quite some time after that. And then I had a recurrence about 6 years later and started on some treatment. And thankfully, after a couple of years, that worked and my new spots went away. And I've had other tumors pop up in the meantime. So I've had 7 surgeries altogether. And I have had a monthly maintenance treatment for 10 years until 4 months ago. And I have not had any evidence of disease now on a scan for quite a long time. And my symptoms have finally reduced enough where my doctor and I both felt comfortable for the first time in those 10 years in really stopping treatment. And so I'm kind of flying free for the first time in 18 years, which feels very scary
And exciting.
and exciting. For the first time to not have toxic medications pushed in your body in 10 years feels very different. And my body is, I don't know, reacting in new ways. It's nice to not have to go through a cycle of feeling bad and knowing when do I have to be close to home, have to adjust my life all the time to treatment, and what's that going to be like? Can I manage this right now? Am I going to be extra tired this weekend? It's nice to not have to think about that after 10 years.
Yeah, because even though that your treatment was once a month, like the effects during that month took up quite a bit of time. Like, I mean, out of those, what would you say out of that 30 days, or usually it's 28 days, out of that 28 days, like how long did you feel normal, I guess? Or was there any normalcy around there?
I kind of felt like I had a good 10 days in the
10 days.
middle of that time period. And I would have on hand, I probably have 6 or 7 medications that I would need to take as needed. So pancreatic enzymes and other things to help with diarrhea and all these other medications to help with the side effects. And I don't have any of that anymore, which is kind of amazing. And however long this lasts, hopefully it's a really long time. But if it's not, I'm appreciative of the break that I'm getting and to actually just feel good and normal for this amount of time.
And how often are you doing scans?
Well, my scan was delayed because of COVID. But I've been doing a scan every year now. And there was a time period where we kind of stretched out a little bit. I would go longer, but then things would pop up again. And so I've been back on yearly scans.
Yeah.
As soon as it's safe for me again, I'll be back to get my scan again.
Yeah, so let's talk about you and COVID because, you know, with you having a lung cancer and that is even high, it seems as though it's even higher recommendation of precautions and even just probably say for myself, being a breast cancer survivor, I mean, that's, my lungs are pretty healthy. So what kind of precautions did you take, say, in March, and then as things are opening up for yourself?
I've been pretty much locked down at home under my doctor's recommendation, just because I don't have all of my lung volume. And even say if I get a regular virus like a cold, for me it'll take 3 or 4 months to clear, with a lot of coughing and extra medications involved. So I'm cautious just, in regular flu season, or around people who have a virus. So with COVID being around and knowing that I could be severely impacted, just being super cautious at home, really not being around people. I've been at home for, this is my 11th week working from home, and minimizing any kind of contact. I've not gone into a grocery store for 13 weeks or any other kind of store. I order everything online, and I go to Fred Meyer and they put my groceries in my trunk and I go home.
What does that look like? I feel like that's been a big discussion in the support groups, is like whether people are doing Instacart or people are doing like the grocery thing with Fred Meyer, and then some people are like leaving their groceries on the doorstep for like a certain or throwing it in the outside fridge for a couple days, or like what is your routine look like, I should say?
I will have to say I was probably a bit more fanatical at the very beginning, but now I bring my groceries in and I unload them and just wash my hands afterwards. Yeah. Now with box deliveries, I do bring them inside and then let them sit for 24 hours, and then I open them and just do good hand washing, really. I think they know now, like, even though it can live on surfaces, the amount of virus that's left is pretty minimal. And so I just give myself some extra time. So just really being super cautious. And honestly, I did have a conversation with my doctor early on and said, if I were to get severely ill with COVID, like, this is what my wishes are, and really had a conversation with my family, and actually redid my advanced directives, and went through all of that process, because I understand my personal situation and how difficult it might be for me. So I took the step to move forward and really just have that conversation with my doctor.
Which is probably, I mean, like, in some part, like, it needed to happen. I've, rumors told that a lot of changes have happened in your personal life. But she's getting married soon. But also, I feel like, as a cancer diagnosis happens, we kind of have to face it head on, a potential, death. And then, as you're surviving, I feel like we are sometimes, we know that everything's put together. And so we kind of try not to always go to that dark place. But with COVID, it is a good reminder that, like, that, making sure your advanced directive is up to date, making sure that, especially since 18 years have went by for you, like, just making sure that people are aware of the conversation that that needs to happen. So
yeah, like Katie said, I'm engaged, getting married in October in the world of COVID. And so I did, proactively want to have that conversation with my fiance, but he was like, you have to tell your family, because, like, I'm new in the game and they've been with you through all those 18 years, and I don't want them to think, like, whatever you say in your advance directive, that, or me following through on your wishes, that it's any part of my idea. I want you to, like, tell your wishes to your family as well. So I did that as well, like, talk to my family about, hey, if I get COVID, these are my wishes. and did that extra step so that he was included and they were included. And I had not updated my advance directive for years. And so it was just a good time to do it and to have that conversation. And, it's a tough conversation to have. And it's not easy, especially with, a person who I've been with for a few years, but who has not seen me at my sickest.
Yeah.
And so but I felt it was really important for me to just lay it out there and have it done. And, it's an emotional thing to do, but then now it's ready and it's behind me. And if something ever happened to me, at least I know that's taken care of. I don't have to do it in an emergency situation.
Good. Well, I'm very excited about this potential wedding in October. It's always interesting on what people are going to do. So now you work at Willamette Valley Cancer Institute, and most of our patients are patients of Willamette Valley Cancer Institute physicians. So what kind of precautions have Willamette Valley Cancer Institute been taking? I mean, let's talk, I know that I heard that quite a few of the physicians were doing lots of research from the very beginning. I watched the Targeting Cancer on Dr. Dunn and the Mass. And then as things are opening up, what kind of recommendations or what kind of changes will be taking place at the Cancer Center?
So
that's a lot of questions.
We have been really early on. We were probably more prepared than other clinics because we know that our entire population is essentially vulnerable. So there's 4 of us we have a large COVID task force, but there's 4 of us who lead the COVID task force. Dr. Lonergan, who's our chief medical officer, myself, Debbie Piccolo, who's the practice director, and then Lynn Bergander, who's our physician assistant in the gyne department. But the great thing about Lynn is she also has a master's in public health and epidemiology.
Oh, wow.
And so she's been amazing to be able to help us from a public health standpoint and give us advice on what to do. So we've been prepared pretty early on and starting putting things in place. So for patients who are coming, unfortunately, we have a limited visitor policy in which if you're a new patient, brand new patient consult, you can bring somebody with you. But for now, no other visitors are allowed in the building. And I don't see that changing at this point until we have enough space to make sure our patients are 6 feet apart and that they can have a family member with them and also be 6 feet apart from the next patient and family member.
Yeah.
So I know that's really hard on our patients. And they feel, that loss of support, especially when they're coming to infusion room to sit for 6 or 7 hours to not have that family member with them is really hard. But I don't know when it will change. A lot depends upon, just the advice from the government of when we can really start to change things.
Yeah, I mean, I keep thinking, with our support groups and things, like, even though phases keep happening, it's like, I look at what we're doing, and like, say, support groups and, like, when will somebody feel comfortable, I mean, to come into it in person? I mean, even after phase 3 is done, like, will they feel comfortable? Or, is it something that we're just going to have to keep on Zoom? When you have we all know what it's like to go through treatment, and, when you have a small window, is it really something that you want to risk just to come and talk to somebody? So keeping it online is probably what is going to happen no matter what phase we're at for quite a long time, really.
Yeah, we're also going to be doing some of the support groups we've had in the past online and have those available in June at some point. And yeah, there's certain services that we just, unfortunately, we want to keep our patients safe. And one thing that we're doing is offering testing to patients prior to cytotoxic chemotherapy. So not all treatments that people get will really have a huge effect on their immune system, but for patients where we know it's really going to have an impact on their immune system, we're offering pre-chemotherapy COVID testing. So a couple days ahead of chemotherapy, patients can go and get a COVID test after a conversation with their doctor. If that's something they both agree on that they want to do, and it's in the patient's best interest, that they go get screened for COVID. And we've kind of arranged that in all of our different locations for people to be able to do that, just so that we're not, like if a patient has COVID, we're not chemotherapy on top of it and really making them much more vulnerable to severe illness.
Now, is the recommendation for, like, say, whoever lives in the house to get tested as well, or is it really just the patient, or
really just the patient?
Yeah.
Right. So
and is this the test that is because there are a lot of tests out there? Is it the 3-day like blood test? Is that which?
Nope, it's a nasal swab. So right now, antibody testing, which is the blood sample, honestly, they still don't quite know what to do with those results. Because you have to have a certain amount of viral load and past infection to be positive that way. And they don't quite know what to do when people continually screen positive again, and they don't know if it actually protects your immunity yet. So we're kind of waiting on that for further information, but we know that if we put a nasal swab up your nose and you have virus up there, and those tests have gotten a lot better. They're pretty accurate now. Then we know that, like, you have COVID, whether or not you have symptoms.
Yeah, that's true.
So we're doing that for our patients and offering that, and that's fairly new. All patients who've been visiting the clinic know that they get a temperature check and a symptom check at the door before they walk in. They probably don't know that all of our employees actually do the same thing. Employees and physicians actually do a temperature check and a symptom check twice a day.
Oh, really? Wow.
And we really have just made sure that, we want to make sure any exposure in the clinic is reduced for our patients. So all of our healthcare workers are monitoring themselves twice a day. And we actually do a check at the back door for all of our employees. So keeping people extra safe, and all of our infusion nurses, radiation techs, like anybody who has a lot of extended amount of contact with the patient, they're wearing full PPE, which is gowns, gloves, goggles, and mask all day long. It gets really hot, and it's hard on them because it's just a lot of PPE to constantly wear.
Yeah.
But we know it's actually the safest thing for them and for the patient. And so I don't see us actually stopping that anytime soon either. And when you come into the clinic, if you don't have a mask with you, we'll give you a mask, but people come masked, that's great.
Where are you getting these masks? I keep seeing like these call to action to the community members. So are the masks that you're giving to the patients, if they don't have one, are those donated to you?
Yep, they are all donated. Because we're not part of a hospital system and we're a private practice, we don't have access to essentially the government loads of PPE. So we have to purchase and source all of our own PPE. So we have really relied on our community for facial coverings for our patients, and it's been awesome, the outpouring of help that we've been able to get, because it's so important for our patient population that we continue to be able to offer them a mask and make sure everyone's masked in the clinic.
And so if somebody is watching this and they want to donate masks, do they just bring it to the office? Do they call and arrange a time to drop it off, or?
And come anytime that we're open. We're open Monday through Friday at our country club office.
Just wear a mask.
Yep, we're there from 7:30 to at least 5:30 every day, and people can just drop them off anytime.
Great.
It's been it's been really great that we've been able to continue that process of offering a mask to everybody.
Now, last question, because our time's kind of running out. We can ask more, but what are some physicians doing, like, for instance, like Zoom calls for appointments, or
We're offering, definitely offering telemedicine visits. We use a system called VC. But, so if patients are interested in having a virtual visit instead of coming to the office, which is keeps everyone a lot safer, they can definitely talk to their scheduler about it. And even though we're not allowing visitors in, I definitely encourage people, like, once your loved one is in the room, like, get on a phone with them so you can still participate in the visit. Do a Zoom call in the room,
yeah.
do a FaceTime video call so that family members still feel a part of that visit and can get their questions answered as well.
That's a great idea. Well, thank you so much, Anne, for taking the time and just, helping answer questions. I know that this has been, every Zoom call that we've had, every support group that we've had since March has been about this and what precautions different people are taking. And I think, as cancer survivors, it's always nice to hear what people's journey was, as well as what they feel comfortable with, to kind of gauge on what other people feel comfortable with. So this was really helpful, and I really appreciate you taking your busy time.
Thank you, Katie. It was great to see you. And if you get more questions about the center or what we're doing, just reach out to me and I'll be happy to get you the information.
Perfect. Okay, well, I'm going to